Welcome back to WBRZ News 2 at 4. Dr. Anthony Stevens is here, and we're talking the basics today about breast augmentation.
Right.
And you have some examples here.
We do. And the first thing we need to talk about is that you need to be, if you're considering breast augmentation, make sure that you see a board-certified plastic surgeon, one that can tell you all about it, and make sure that you're a good candidate. Your basic choices when it comes to implants, if that's what we're talking about here, is we have the saline implant, which has been out for many years, and we usually fill it up with a little tab here, and a little spigot goes in, and we actually fill it up, and it goes in, you know, it's pretty small. We also have silicone gel implants now, which have been out for about 4 years for most of the population, which are a great choice as well. There's the gummy bear implant, as it's called, or the shaped implant, which we have here, and we also cut it to show people what happens. You know, they always wonder, well, what if it ruptures? And this is what happens here. Same thing with the other silicone implant. It doesn't go throughout the body, it just stays right where we put it. So both are great choices, and that's why we need to see the appropriate physician to make sure that we are, one, a good candidate, and two, to make sure which implant is going to be best for you.
In your experience, what is the best?
Well, there isn't, you know, I get that question all the time. There's not such thing as the best implant. Some implants are better for certain women. Women that have thin skin, the silicone gel implant is going to be better, and it doesn't ripple like the saltwater implant will. So yes, that's probably a better implant. For somebody that has a good bit of breast tissue, it probably doesn't matter which implant you use. But it's safe to say that the silicone gel implant is going to be softer, it's going to look more natural, and feel much more natural than the saline implant will.
Okay. Tell me a little bit about the incisions.
Well, there are various incisions that we can make. Most incisions nowadays, if you pull most plastic surgeons, it's underneath the breast, in the crease of the breast. But incisions have been placed anywhere from the belly button all the way to the arm to put them in.
The belly button?
Absolutely. Called, you know, transumbilical breast augmentation. It's done, but there are various problems with that. You can imagine going from the belly button trying to through a tube and putting it in the right spot. It's very difficult to do. Not recommended.
Not recommended. Okay. Well, thank you so much.
Oh, you're so welcome.
Dr. Anthony Stevens for coming on today. You're watching WBRZ News 2 at 4. We'll be right back.